I want to thank Brother Bowen, Brother Brown, Keith Brown, Pastor, thank you for that wonderful prayer. I want to welcome everybody here to Morehouse School of Medicine. My name is David Hefner. I'm the Chief of Staff and Vice President for Strategic Planning. I bring you greetings on behalf of our President and Dean, Dr. Valerie Montgomery Rice. She is in Florida working on trying to raise money for all the various things that go along with running an institution. As you all may or may not know, presidential leadership at higher education, particularly HBCUs, is tough. Raising money is paramount. And so presidential leadership increasingly is about fundraising. And so we want to thank Dr. Montgomery Rice for her vision and her leadership, and she brings you all greetings and welcome to this institution. Morehouse School of Medicine is celebrating its 40-year anniversary. We were born out of Morehouse College. The president then, Hugh Gloucester, along with a family medicine physician named Louis Brown, had the vision of starting Morehouse School of Medicine, which is the earliest or the last medical school, HBCU in particular, to emerge in the 20th century, 1975. The idea then and now was that there was a disparity of health in Georgia. There was about, for every one African-American physician, there are about 13,000 African-American residents in Georgia. 1 to 13,000. For white Americans in Georgia, for every one physician, there were 700 white citizens. What they found was there was a correlation between the number of African-American physicians per capita in terms of the number of African-American residents and health. That to a large extent, for various reasons, if you don't create a pipeline of more African-American physicians who care for the needs of the communities in which they live and serve, then you'll continue to get a disparity of health in various populations. And so then, 1970, the research was done. 75, Dr. Gloucester, Lou Brown had the vision, and along with a team, to start Morehouse School of Medicine, and we launched the first 2-year program at Morehouse College. In 1981, we became separate from Morehouse College. We formed Morehouse School of Medicine with our own board of trustees, own charter, so now we are separate and apart from Morehouse College, but we also, we continue to carry the Morehouse name proudly. Yes. So we are a professional school, graduate programs. We offer the MD degree, PhD degree, master's degrees, and we also have 7 residency programs. And so we want to thank you all here. How many people are parents in the room? Raise your hand if you're a parent. Many people are here are parents. We all know parenting is a tough job. It's a tough job. I'm a parent of 4. My daughter is a junior at Spelman. Is she in the house? Asanta, are you here? She's not here yet. She's coming. It's tough. I have a daughter and I have 3 boys. And, you know, I remember coming in high school, I remember home economics. Raise your hand if you remember home economics. That's old. I should have taken home economics. I was ill prepared for parenting. And I had a mother and a father in the household, and I modeled my father being a father after my father. He was from a generation in which essentially being a provider was what was the criteria for being a good father, providing. He provided in an extraordinary way, never failed. He was a university professor here at Morehouse College. He went on to become university president for 21 years, quite busy. When I became a parent myself, one thing I recognized was that though being a provider is important, what children need to a large extent is your time. And so today I work long hours, I go home, I spend time with my kids, I go to bed late, and I wake up early. It's tough. It's tough. And so I want to thank all the parents who are here for the University of Parent. I want to thank the vision of Susan Taylor. We owe a tremendous amount to the incomparable Susan Taylor. Thank you, Ms. Taylor. She's done so much for the African American community across the nation, internationally. And we are partnering with National Cares, with Atlanta Cares. We have adopted an elementary school here, Conley Elementary School, which is down the street from here, not far from here, a few blocks. And under the vision of Dr. Montgomery Rice, we have adopted as mentors every child at Conley. We're still working on that plan. But our goal is to mentor every single child at Conley. So every MSM, Morehouse School of Medicine employee will have a mentor, or mentee rather, at Conley Elementary School. The question is, well, why would a medical school be involved in mentoring at the K-12 level or the K-5 level? Good question. I'm going to be brief. One thing we understand is that you can't deal with health in a vacuum. Health was cradle to the grave. Health starts in the womb. And it goes all the way up. So if you only deal with health from an intervention standpoint, you have started too late. You have to start from birth all the way through being an elder. And Morehouse School of Medicine understands that unique responsibility. Yes, we train biomedical scientists. Yes, we train MDs. Yes, we train students who want to be Master of Public Health professionals, Master of Clinical Research. Yes, we do all of that, but it doesn't stop there. We have to reach back and deal with one's environmental or social determinants of health. What's your home environment like? How much stress do you bring to school? How much sleep are you getting? How much nutrition are you getting? All those things affect a child's ability to learn, which correlates to health. So the beauty of being in this profession is that it's not just about training physicians. It's about building a community and developing what we call health equity. I want you all to say health equity. Health equity. And what that means is providing a community what they need, when they need it, and the amount that they need in order for that community to reach their optimal level of health. So if there are inadequate books in a school, that's a problem. There's a correlation between reading, finishing, persisting at K-12 level, and going to college. If you can't read, they're doing what? They build prisons based on third grade reading scores. Reading scores. If the nutrition in the school at home have challenges, we have to be a part of the village that begins to create a community around that issue. So I want to thank you all to Morehouse School of Medicine. I know Dr. Wren, I think is coming too. Dr. Wren is coming to greet you all as well. I see Tommy Dortch now. Thank you, Brother Dortch. I want to thank all those who are beginning the launch of the University for Parents. If you're in the class, the first inaugural class, raise your hand, please. Raise your hand high. Okay. I want you to know that you have a partner in Morehouse School of Medicine. We're in this together. We're in this together. This is a journey, it's not a sprint. And we are committed, our president and dean is committed to ensuring that the notion that it takes a village to raise a child is real. What I've learned as a parent is I can't do it alone. I have coaches whom I talk to who coach my child. And they understand they're an extender of the parenting. So it takes a village in all of the communities. So again, thank you all for coming. I hope you have an enjoyable time here at Morehouse School of Medicine and look forward to working with you all in the future. Thank you.